Hello, everyone, and welcome back to Psychedelic Vantage. Today, I have the pleasure of speaking with Dr. Rick Barnett, a licensed psychologist doctorate, a licensed alcohol and drug counselor, and the co-founder of the Psychedelic Society of Vermont. When I was thinking about interviewing someone for the topic of psychedelics and addiction, Dr. Barnett was the first person that came to my mind. So I am really excited to have him on the channel today. Thank you so much for coming on the channel, Dr. Barnett. Dr. Barnett, how are you doing today?
I'm doing excellent. Thank you, Jake, for having me on the podcast here on the show. I'm happy to provide whatever insights I can and experience, and just have a really deep conversation on this important topic.
Awesome. Thank you so much. And we'll get it going. So can you share a little bit about your background and how you became interested in psychology, addiction psychology, and how you became interested in learning more about psychedelic therapy for addiction?
Absolutely. I've shared this before publicly. It's something later in my career I feel more comfortable in sharing my
Mhm.
background. It's kind of interesting or funny. Some people might think it's kind of a bit of a trope in a way, but when I was young, I started using alcohol and drugs at a pretty young age,
Mhm.
and one of the drugs that I used at a pretty young age of 15, I used LSD for the first time. And that was a profound experience in my life. And, for the next few years, it kind of was a shit show in terms of my alcohol and drug use. But, I eventually got into recovery, and my experiences with psychedelics in my active addiction really has had a profound impact on my life, and that's what got me interested in psychology. So I
Mhm.
had I had known that from a very early age, from my experiences with psychedelics, that the mind, behavior, human interactions, the interaction between humans and the greater world around us was just very, very fascinating. So it wasn't a leap. Once I got sober and it was clear that I wanted to pursue psychology or psychiatry,
Mhm.
that I pursued that in my education. And then, come full circle, decades into my career as a psychologist, to see the psychedelic renaissance take off, knowing that, like, throughout my own recovery and throughout my career, I had always known that psychedelics had a place in human, human in change, the
Mhm.
change process potentially. So seeing all this research come out, it was like a coming home, really. It was like, holy shit, like, now this is the real deal. This is something I always knew from personal experience. This
Mhm.
is what got me into recovery. It's what got me into psychology, mental health, helping other people. And now it's come full circle in taking center stage in some ways. I mean, I think there's still a lot of people that believe psychedelics are still fringe, and there's a
Yeah.
tremendous amount of stigma around psychedelics. Those of us who are in the psychedelic world and we're talking about it all the time, we think everybody's on the same page, but that couldn't be further from the truth. There's still so much stigma associated with it.
Oh, absolutely. So first of all, thank you for sharing about your background. And also maybe we could even touch on stigma, especially with psychedelics and addiction recovery. That's a very interesting topic. I was curious actually to ask if um your work and interest with psychedelic therapy for addiction, is it for primarily focused on substance addiction, or also behavioral addictions as well, like gambling disorder, eating, stuff like that?
It's really interesting just in general in the field of addiction. I think the process addictions or the behavioral addictions are still a little less accepted as bona fide conditions in the
Mm.
treatment world. Now, gambling disorder is the only behavioral addiction or process addiction that actually made it into the manual that we use for diagnostic categories. But food addiction, for example, is something that's still very controversial.
Hmm.
Sex addiction is still something that's very controversial. I don't think it needs to be. I think addiction in general it can be a unified concept. It doesn't have to be specific to a substance or behavior. There's something about addiction that has a universal quality for those people who get caught up in addictive cycles. Um, that's one thing. And then there's just being human. Like, we like instant gratification.
Oh
We
yeah.
like we like any one of us can be prone to developing an unhealthy pattern with a substance or a behavior. So it's not really, addiction is something that's almost potentially embedded within all of us. So when it comes to psychedelics and addressing addiction with the use of psychedelic medicines, all we have right now with the research is really focusing mostly on substance use disorders or
Got
alcohol
it.
use disorder, with the exception of gambling disorder and ketamine. So there's some research with
That's right.
ketamine and gambling disorder.
Yeah. Okay. Thank you, Dr. Barnett. And I guess what is the current state of research looking at psychedelic therapy for addiction? What do we know now and what don't we know?
Yeah, there was a recent meta-analysis done on looking at what are the mental health or addictive disorders that are most studied when it comes to using psychedelics as a tool to help people with those conditions. And depression is at the top of the list.
Yep.
Addiction, in terms of the volume of research on addictive disorders, whether it's alcohol or cocaine, it's probably down in the fourth or fifth diagnostic category of most examined conditions with the use of psychedelic medicines. So the status is really a lot of research, as you know, going back to the 50s and 60s, a lot of research with LSD and alcohol use disorder, but unfortunately, a lot of those studies weren't well designed. People criticized them as being, having poor methodologies and poor, not, double blind, placebo controlled, randomized kind of thing. It was more back in the day, it was less, it was more all over the map. But today, the work of Michael Bogenschutz and Matt Johnson and Peter Hendricks and a number of folks in the field looking at alcohol use disorder, looking at cocaine, looking at nicotine use disorder, smoking cessation. I'm very optimistic, and I have a, like I said at the beginning of the program, I have personal experience with this, and also
Mm,
I've seen it in other people where psychedelics absolutely have a huge role to play, I think, in helping people overcome various addictions. So the research is very promising. I think we could do a lot more in terms of increasing that volume of research. I'd like to be involved with that more personally, as professionally in the field.
mm,
But I think, yeah, I think it's really important to keep looking at not only like psilocybin, for example, is the psychedelic drug that's been most studied
yeah.
in contemporary society when it comes to addictions. But one thing that I posted on social media and I'm very interested in is 5-methoxy
Yeah.
dimethyltryptamine, 5-MeO-DMT, and that I think has particular promise for treating addictive disorders, even though it's that could be controversial and it's a very powerful medicine.
Yeah. I'm definitely hearing that a lot. Aren't you if correct me if I'm wrong, didn't you receive training from Five, I believe it's called Five, for facilitation for 5-MeO DMT?
I did. I went through a very intensive year-long
Oh
training.
wow.
It was every Monday night online through Five. That's 5-MeO Information and Vital Education, FIVE. And that's through Joël Briere and Victoria Wushner down at Tandava Retreats in Tepoztlan, Mexico. And at the end of that year-long training, there are 13 or 14 of us in our cohort. We all got together on campus, so to speak, for 2 weeks, total immersion to train with the medicine, the different tools, routes of administration. Really not for personal healing or any kind of. It was really just like, this is how you use this medicine safely, legally in Mexico, ethically, and it was very intensive. And I really appreciate those guys for putting together such a great resource on 5-MeO DMT, because it is such a powerful medicine.
Yeah, absolutely. And it's definitely less researched from my understanding than psilocybin, for example. I also wanted to ask you, so obviously, psychedelic therapy isn't, legalized, across our country. But with that said, people are obviously taking psychedelics and probably a lot of time for addiction as well. In your practice, do people come to you ever after a psychedelic experience to maybe help with integration, like after they have the experience? I wanted to ask you about that.
Typically, people come to me in my therapy practice, both just as a consultation, like what do I think about psychedelics as a potential tool for mental health or addiction, whatever they, or maybe just personal curiosity, personal growth.
Okay.
And some people come in specifically for preparation. What do I need to know about this? I'm
Mm,
planning a journey with such and such group or on my own or something. And so it's really a harm reduction model where I'm just
got
providing
it.
education and information to help them make the best decisions. I don't promote the use of
Yep.
a substance or any illegal behavior, but at the same time, I feel like I have a responsibility with the knowledge and expertise that I have to share with people what they need to know about these experiences. And so on the back end of psychedelic experiences, people do come to me afterwards and say, I had a very profound ayahuasca experience in Peru or Mexico or something, and or Costa Rica, and I need to talk about it with somebody who's not going to
Mm,
judge me or who understands what these experiences are like. So people do come to me for integration. I think one of the things about integration, since we're on that topic, is really important is community. And you know from my posts, how strongly and passionately I feel about building community. And I
mm,
think a lot of the work in psych, or a lot of the healing or the process involved with psychedelic medicine use has to do with integration and integration within a community. It could be a small community. It could be just a group of friends, you know, where
mm,
you're building community, or it's a group of health professionals, or it's a group of people who identify as a certain, you know, gender or sexual orientation, or like building community as the primary tool for integration and healing from the with these medicines is really important. So I think when it also comes to research and how are we going to roll out MDMA, how are we going to roll out psilocybin in a medical setting, I think if we can outsource some of the quote
mm,
unquote clinical work to like a model like on the topic of addiction, like a 12-step model. There's a lot of wonderful communities out there that have been built around the 12-step model. And why can't psychedelic integration map itself onto a kind of recovery community model to help people continue their healing process long after their psychedelic journey?
and we have some of those groups now, I believe. I don't think they're common, but they do exist to some extent, right? Isn't there a 12-step recovery program for people who use psychedelics to help with addiction?
Yes, there's a group called Psychedelics in Recovery, and
That's
that's a
correct.
12-step based program that is you know heavily influenced by the lineage of the 12-step model, but also involves people who talk about you know other things like trauma and
Mm,
um, you know spirituality maybe in different ways, codependency, relationship to family members.
yeah,
So there's psychedelics in recovery. I also know that there are some psychedelic societies. I believe the San Francisco Psychedelic Society with Danielle Nova. She has uh, uh, part of her, the San Francisco Psychedelic Society has an addictions recovery community. And I believe they do exist. They don't have to be 12-step based. They exist, I think, across the country and internationally. I think the 12-step model in particular has been around for so long, and this idea of fellowship or fellow travelers on this journey, this human life journey, I think the 12-step model lends itself very nicely to that, and it's been
mm,
around for a long time.
yeah,
And maybe it has some structures built into it to maintain a certain container that doesn't go, you know, psychedelics are great disruptors, and so you could imagine how that could, you know, communities have in the past gone completely off the rails with bad actors and, you know, bad,
mm,
you know, unfortunate behaviors and things that have happened. You think about Millbrook and Timothy Leary and
mm.
Ram Dass in upstate New York with that big mansion that totally went sideways. They were trying to build an international community of psychedelic enthusiasts, and that, that turned into debauchery. So, you know, it's very important to have some guardrails when it comes to building community.
Absolutely. It's great to hear about these support groups. I mean, clearly, just in life in general, but also with addiction, community support is very important. So it is. So is it thought that specific psychedelics might be better for one form of addiction when compared to another, or one form of a substance use disorder compared to another? Do we even have enough data yet to maybe even point us in a direction at this point, would you say?
Yeah, I don't think so. I don't think there's a specific, I think the nature of a psychedelic experience itself, whether it's from psilocybin or MDMA or ketamine, if we're going to lump them all together, 5-MeO, DMT, mescaline, uh, ayahuasca, they all have a component of changing your consciousness and maybe helping people become aware of their thought processes, their behaviors, their relationship to others in a way that we don't have access to in normal day-to-day life. In that sense, they share a sort of common phenomena. And so getting specific about a particular molecule for a particular addiction, I don't think we're there yet. And I think that's true. Even you take psychedelics out of the picture, we don't have a specific therapy model, for example, that seems to be better for heroin addiction or opioid use disorder compared to alcohol use disorder.
Hmm.
We have medications, for example, that are maybe more specific to a particular condition because of their pharmacological action. So, for example, we have methadone or buprenorphine, Suboxone, or naltrexone for opioid use disorder. And for alcohol use disorder, we have camprosate, we have antabuse, disulfiram, we have actually naltrexone. So there's a medication that cuts across different addictions. Naltrexone, also known as Vivitrol
Mm.
or Revia, it's an opioid blocker, but it also blocks some reinforcing properties of any kind of addictive process. So it's been shown to be helpful for gambling use disorder, alcohol
Oh,
use
wow.
disorder, blocking the effects of opioids. So there's a drug that works very differently than psychedelics, but it is used across addiction. So I think
Mm.
loosely we can think of all psychedelics as having the potential to disrupt familiar addictive patterns to redirect people into a healthier way of living, and maybe shutting down or reducing the power of the addictive craving and pull. So yeah, I don't think, I think five I go back to 5-MeO DMT. I think it's a short acting drug, it's extremely powerful, it reliably produces an extremely um ego dissolving unity consciousness kind of experience that I think is really important when it comes to treating addictions, to really have that powerful ego dissolving experience. We can get that with high doses of psilocybin. We can get that from other substances. But it's interesting, Jake. There was a podcast I saw with Kyle Buller from Psychedelics Today. He was interviewing um, a guy by the name of David Olson from
Oh, Delics. Yeah.
Psychedelic. Yeah, and also he was interviewing Gul Dolan, who's now in San Francisco, as well as David Nichols, the legendary David Nichols. So he
Yep.
had those three people on, and they were discussing taking the psychedelic experience, the mystical experience, out of a psychedelic journey. And it's a popular topic that doesn't seem to get old, even for those of us who are. And I think one of the points that they made in that podcast is that when it comes to addiction, it doesn't seem wise to remove the psychedelic experience. Maybe when it
Mm.
comes to depression and trying to scale a new pharmacological treatment for depression, maybe the mystical experience isn't quite as important. But I really resonated with this idea when it comes to addiction, to the extent that we can assist people in finding a new understanding of themselves and the world and their relationships to people that has a more philosophical, mystical, spiritual
Hmm.
component to it. I think that's really important with addiction. Maybe less important for depression. I don't know, but they made that point. Like, I don't think we want to be taking the psychedelic mystical experience out of these journeys when we're helping people with addiction. We need to keep that in there.
Hmm. Yeah, absolutely. I think about that a lot. Something that's always really fascinated me about psychedelics for addiction, more specifically here, I'm going to talk about Ibogaine, then follow up with a question. So, when it comes to ibogaine, at least from, I guess, anecdotal data, we know that not only do people not only can ibogaine, like you said, with psychedelics, disrupt these maybe thought patterns or potentially get to looking at root causes of addiction potentially. It also, with ibogaine, there's reports of people no longer having the physical withdrawal symptoms. So it's really seems like it's addressing quite a bit with opioid addiction. I was curious if psilocybin and or 5-MeO DMT with the research or the reports, do people experience also less physical cravings with those psychedelics as well?
That's a good question. From a pharmacological perspective, there's nothing to indicate that there's anything happening at the pharmacological level or the biological level that psilocybin or other psychedelics are actually helping with the physical craving, the withdrawal, any of those kinds of physiological or physical things. With ibogaine, there seems to be some evidence that
Yeah.
the way it works on the opioid receptors, it does do something to really, minimize or reduce the physical cravings or the physical withdrawal from. It's also a very protracted psychedelic experience. It can last 24, 36 hours plus. And, it's possible that someone's getting through maybe the bulk of the the physical distress during that long, 36-hour journey. I think one of the things that maybe doesn't fully get addressed with any psychedelic is more the psychological side of things. I think, again, they're great disruptors, whether it's ibogaine or 5-MeO DMT or psilocybin. It can disrupt our understanding of ourselves and the world and our relationship to these substances or behaviors that are really unhealthy for us. But we still have the phenomena, this psychological phenomena of like craving for it from a psychological or like almost like a spiritual thirst perspective. Like we're
Mm,
hungry for connection.
yep.
And I think hungry for freedom, hungry for understanding, we're hungry for growth. We're spiritual seekers on some level. And psychedelics, on the one hand, can really tap into that and help redirect our attention to other things rather than trying to get that from a substance or behavior.
Mm,
But I think a lot of the work is really not even in the medicine. After that, after the psychedelic experiences, like how are we addressing those spiritual seeking needs or the needs for freedom, the needs for connection? How are we doing that without drugs, without the behavior, without psychedelics? How are we integrating that into our day-to-day lives? I don't think any psychedelic experience can necessarily do that work for us. We still
mm,
have to develop some system within ourselves that keeps us really, both grounded on planet Earth and also like still looking out into the world at large and being like, what is meaning for me in this life journey, and how do I develop that for myself and for the greater good of myself and other people? And that's a lifelong kind of thing. I don't think a psychedelic drug can do that for us. It can definitely set us on that path for sure. I mean, that's what set me on my whole life path in some
mm.
very practical ways. But I also had to figure it out for myself too.
So when you're speaking about this, and I'm glad to have you on the channel as a clinician to ask you this question, because I haven't asked, I don't think, any clinicians about this yet. Only the CEOs of the psychedelic medicine company. So, there's a lot of talk just thinking about psychedelics, if they're integrated into, our medical system, how that rollout, I guess, might look like, or how treatment might look like. Would you like to comment at all about this, debate about psychological support versus psychotherapy? Are they even that different, or is it just like terms that we're using here?
Yeah, I mean, specifically, I think what you're referring to is really interesting in this whole MDMA FDA approval process,
Yeah.
ecstasy, 3,4-methylene dioxymethamphetamine. What do they call it in the MAP studies? It's like
Mitoamphetamine, I think.
yeah,
Yes.
methamphetamine. Yeah. So that's ecstasy, Molly, and that's being hopefully approved for PTSD at
Hopefully, yeah.
some point. But right now it's sort of bogged down. One of the reasons why it was bogged down, among other critiques of the research, was like, how do you define or how do you regulate, how do you measure psychotherapy? The FDA is a medication approval or medical device approval process. It's not a psychotherapy approval process.
Yep.
And so they got really hung up on this because it was presented to them, this new drug application was presented to them as a drug plus therapy, but they don't regulate therapy. And so we get into this debate around what is psychotherapy, what is psychological support.
Yeah.
And you know, one of the things that I've been posting about and other people have noticed and are also posting about is that we think about buprenorphine, Suboxone for opioid use disorder. We think about methadone when it came out in the 1960s for opioid use disorder. And how did they market that? How did they introduce this medication for an addiction, for a mental health or behavioral condition, a drug, but needing and wanting to have psychological support embedded within that process? And with buprenorphine Suboxone approval in the year 2000, what they did was they crafted the language to say, look, office-based physicians or prescribers can prescribe Suboxone. They have to prove that they have the capacity to refer to psychological support, to
Oh, wow.
psychotherapy, but they don't have to only beholden to, like, I can't prescribe this drug unless you have a therapist. I can't prescribe this drug to you unless you are in some form of psychological support. That's not how it's set up. So can you do that with MDMA, for example? Can you prescribe MDMA after maybe somebody has gotten a diagnosis of PTSD, and you show the capacity that you can refer the person to a provider that does the preparation, that can hold space for the person? The prescriber is there on site or off site, maybe telehealth, to prescribe the medicine, to oversee it, and then also to provide the psychological support or the psychotherapy afterwards. So that's one way to look at it, Jake. And the other way to look at it is, like, I'm not, convinced that the medical model is the way to go and
Hmm.
that formal psychotherapy is necessary in these cases. I
Hmm.
mean, we look at the underground use for years and how this is rolled out, outside of the medical settings for years. And there isn't this mandate for psychotherapy. And there is a role, going back to community and psychological support in a broadly defined kind of way. Psychological, emotional, social support. It doesn't have to be done within a medicalized medical setting or system. It doesn't, I really don't think it needs it. I think if people are highly dysregulated and very challenged emotionally or psychologically, then I think psychotherapy, like formal therapy, is indicated. But
Hmm.
how many people are fairly high functioning? They might have a diagnosis of depression or they have diagnosis of PTSD, but they're doing okay.
Okay.
And they're not decompensating and they're not in need of like high levels of support and intensity in a medicalized kind of way. They just need extra support. And so I think there's room for both in the in
Hmm.
the in the medicalized version of what we're going for here. There's room
Yeah.
for people to make sure that they have access to a therapist to do psychotherapy, but also to see if they have access to community, to social supports, psychological supports outside of the medical system. Both can coexist.
I see. And I agree with you that both can coexist. Yeah, it's something I've been thinking about a lot more recently. So with your experience working with people who have taken psychedelics or have done psychedelic assisted therapy to help them become sober or even maintain sobriety, I also want to ask you more about that later. What can this journey look like for someone in the present day? I apologize, I know it's a broad question here.
Yeah, I mean, I think you sort of alluded to it earlier in our conversation. There's the stigma around using a psychedelic for an addictive disorder, certainly a substance use disorder. The common argument is you're just substituting one drug for another. So someone is addicted to alcohol or heroin or cocaine, and you want to give them LSD or psilocybin or MDMA, like they're just going to get addicted to that. So you're
Mm,
just substituting one for another. And that's such a sad commentary on really limited thinking around this particular topic when I
yep.
hear people say that.
It's
But at the same
crazy.
time, I think it's healthy to have an awareness that we can get addicted to experiences, and there are a
Yeah.
very small subset of people who will, use MDMA, and I know some of them who use MDMA in unhealthy ways and develop an unhealthy relationship with MDMA or ketamine, or frankly even LSD. People want to use LSD. For example, I used LSD when I was young simply to help me drink more. Like
Oh my God.
if I took a hit of LSD and I wanted to drink a 12 pack or, 18 or 20 beers, the LSD really helped keep me alert and awake, and I could drink more. And so you have
Wow.
this phenomena where I became dependent on LSD to help facilitate some other unhealthy
Oh
behavior.
wow.
Um,
Wow.
so I think people can find ways to develop an unhealthy relationship with psychedelics, but substituting one drug for another, if it's done intentionally, if it's done with preparation, if it's done with the right mindset and setting, I think these experiences have real potential. So what that looks like is people come in and they're really in the throes of an addiction, and they want to have a psychedelic experience to disrupt their immediate addiction process. They might be early in their recovery and
Mhm.
just like got 30 days sober or 60 days sober or 90 days sober, and they really want to, have a psychedelic experience to continue to grow and change in that early phase of recovery. And there's people who are in long-term recovery from addiction who haven't used a drug or alcohol for 10, 20, 30 years, and they're learning about psychedelics, and they think to themselves, I still have a lot to learn about myself. I'm still struggling with trauma. I'm still struggling with depression. I'm still struggling
Mm.
in certain areas of my life. And do psychedelics have a role? Even though I've been alcohol and drug free for so many years, does it have a role in my recovery process? And that's where I think very traditionalist, fundamentalist AA dogma, certain personalities in 12-step programs will say a drug is a drug is a drug. They'll even go
Mhm.
so far as to say if you take Prozac for depression,
Uh,
you're just acting out on your addiction. There are extremists in it within the
yep.
12-step community, but that's not the norm. I think
Okay.
most people in 12-step communities really allow people to figure out their own path. And
Yeah.
if that path includes using a psychedelic to help them grow spiritually, emotionally, psychologically, then, oftentimes people in recovery communities, like, if that's something you want to explore, go for it. If it works out
Mm.
for you, great. If it doesn't work out for you, we're here to support you
Yeah.
no matter what. And so I think at any stage of the addiction process, in active addiction, in early recovery, coming back from a relapse, long-term recovery, psychedelics have a role.
Mm. Well said. Thank you, Dr. Barnett. And I did want to touch on something you said about sort of actually definitely relating back to stigma on psychedelics, people saying, oh, you could just replace this like alcohol with psychedelics, which I mean, it's not impossible. I think it's highly unlikely, but I was the past, let's see, starting last year for 8 months, I was interning at an intensive outpatient program for people with addiction to substances, trying to get sober and stay sober. One of the best learning experiences of my entire life by far. And I love the people I worked with. One of the counselors, actually, because I like to pick their brains on this, people who have more experience than I do, to see what they think. And I said, what do you think about psychedelics for addiction? And this guy, great counselor, top notch, so great, but he did say, he's like, I'm not too knowledgeable on this topic, but if you ask me, I think it's just another excuse for people to get high. And when I heard him say that, it kind of broke my heart a bit. But I also, he did say he didn't know much about it. With all this being said, I guess even stigma maybe amongst clinicians. Do you think that stigma can change if we get way more research being done, or do you think that even if we do a lot more research and have, let's say, trials with thousands of people in the future showing that this works, do you think that stigma will still be there amongst clinicians or even people in the AA community? I guess just people and clinicians.
I very much believe that with more and more research and more discussions like we're having, more and more experiences that are shared,
Mm,
that I think stigma in the addiction recovery, addiction treatment community is shifting and will continue to shift. And I will say that, that counselor's response is it, on the one hand, it is crushing to hear that. On the other hand, like there's always going to be people that is true. That is just, I just wanted to get high. You know what?
mm,
Psychedelics are
yeah,
legal now, or they're decriminalized, or hey, people are using it for whatever. Like, great. That's a great excuse for me to trip my balls
yeah.
off again. Like I want to go trip really hard again. I had good experiences when I was younger, and
Hmm.
all this spiritual, like set and setting, preparation, integration, whatever. I want to, eat 10 grams of mushrooms and see what happens. I,
Yeah.
I, I think there's always going to be people like that. And if we look at ketamine as a proxy, so to speak,
Mm,
ketamine, people do run into problems with ketamine. People,
mm,
whether they have an addiction history or not, they can develop an unhealthy relationship with ketamine. Is that the norm? No, it's the exception, but it does happen. And we're
okay.
seeing it. We're seeing it happening. But there's a lot of people who benefit from ketamine. So to just assume that ketamine is an addictive drug and it's just pleasure seeking and people are just going to go out and get access to it and misuse it and run into problems with it. That's just not the majority. That's the minority. It does happen. We have to recognize that
Yeah.
with the approval of MDMA, with the eventual approval of psilocybin, even in the underground world or the world that we all live in, like, yeah, people develop unhealthy relationships with these substances. And so we do seek pleasure. We do look for escape. We look to avoid things. We want to numb out. And why can't we do that with MDMA or 5-MeO DMT? Like it happens, but it's not the norm. And it's certainly not a reason to keep it criminalized or to
Yeah.
keep it, to, to hold up the medicalization process. I really think we need to keep moving forward with medicalization. We need to keep moving forward with decriminalization. We need to keep moving forward with legalization and setting up the cultural systems, the support systems, the regulatory systems to help create containers to support people around these experiences, because it's going to keep proliferating no matter
Oh
what
yeah.
happens.
Absolutely. I guess the trains left the station, so to say. It seems very true. So I would like to ask you, this is something I've thought about a lot. So with stories of, people getting sober after taking psychedelics, with these people, do you see or hear of these people taking psychedelics again after getting sober to maintain sobriety? And if so, how do they feel about that? Especially if you're someone who, and a lot of people do, understandably, take pride in their sober days, for example. Would love to ask about that, about maybe the continued journey of someone who has gotten sober because of a psychedelic experience and maybe integration afterwards.
Yeah, I think that it's a great question. So, people get into a situation where they use a psychedelic and it's a very powerful experience and it helps them transform them into somebody who used to smoke or use heroin or use alcohol in unhealthy ways, full dependency, full blown addiction. And they have some realization or something unfolds as a result of that psychedelic journey that they say, I don't want to do this anymore.
Yeah.
They just set it down for whatever reason. They realize they don't want to do that anymore. So then the question is it valuable to them? Are they compelled or attracted to using psychedelics again in any kind of way to seek pleasure, to enhance their recovery, to reinforce their newfound sobriety? I think it's different for everybody. I think in general, what the rule of thumb is, in loosely, in my opinion, is really about accountability. Who am I
Mm,
accountable to? Do I have a community? Do I have or certain people that I'm close with in my life where I can say, like, I had a very powerful experience with 5-MeO DMT in Mexico last month, and I haven't had a drop of alcohol since. And
mm,
it was very powerful, but I'm thinking about doing it again. I just want to check my motivations. Is that because I just want to have a 5-MeO experience again, or what's my
Mm,
intention here? And
yeah.
to talk about that out loud with other people, or to really have that sort of moment with yourself is like, why am I seeking this experience again?
Hmm.
But a lot of people develop all kinds of really healthy systems around that. I've seen it happen where people do continue to use psychedelics as part of their recovery process, but they do it in a very intentional way. They have a
Okay.
ritual every Sunday where they sit down with hape, or they use cannabis and get into a meditative state, or they develop a microdosing protocol, or they plan out, 3 psilocybin journeys over the course of 9 months, with
Hmm.
the same person who's holding space for them, the same playlist, and do it in a ritualized, ceremonial kind of way, as a part of their spiritual growth and their process of ongoing recovery and sobriety. I mean, I think about it also like, why do people keep going back to 12-step meetings?
Hmm.
Why do people keep going? And people keep going because they find that not only is there a real community there and bonding
Yep.
and sharing stories, but also there's a remembering. We have what they say in 12-step programs, we have a built-in forgetter, and we forget where we came from. And we
Hmm.
forget the path. We only remember the good, or we only remember the bad. And we just have this sort of this vision that clouds the greater picture. So going to meetings for people that are like, see John over there, he had this experience and that happened to him. That's a good reminder for me because I remember I came from that place or whatever. Now think about that in terms of psychedelic experiences. So if we have this built-in forgetter and we lose a sense of like connection to the divine, connection to other people, to nature, connection to ourselves, because we have
Hmm.
this built-in forgetter, if we go back for a psychedelic experience and have a remembering thing, to remember ourselves, to reconstitute
Hmm.
ourselves again, the whole person that we are. We're connected to all these people and nature and stuff. We tend to forget that. So going back
Yeah.
to have that experience again, I think is a healthy thing. Just like I think it's healthy for people to go back to meetings and remember where they came from and remember why they're on this journey in the first place. So I really do think there's a way to do it as part of a recovery process in a healthy way. And also, buzzword here is accountability, huge
Hmm.
accountability. Because people with addiction, myself included, we have a very cunning, very sophisticated way of convincing ourselves that we're doing something for the right reasons, and we're
Hmm.
really not. We're masters at self-deception. So accountability is a huge part of it.
Absolutely. Thank you so much for sharing. That was really interesting to listen to, Dr. Barnett. And you actually touched on this a bit here, but I guess we could dive in deeper here. This is something that's always really interested me about psychedelics for addiction. What do you make of stories of people who went into a psychedelic experience for fun, let's say, like with friends or just by themselves? I don't know, but no specific intentions. Then they come out the other side and decide to be sober, or they can't even look at alcohol without feeling nauseous anymore. I've heard a lot of these stories. Again, it's so interesting because that wasn't the goal going into the experience. I guess, what do you make of these stories? What does it say maybe about psychedelics and addiction?
Well, one of the things it says to me, and I've said this before, I really don't think we need to look down upon people who choose to use psychedelics for recreational purposes.
Mm,
People who go to concerts, take acid or mushrooms, go to raves back in the 90s, go to raves and take, MDMA, or, plan to go on a camping trip with a group of friends and, take some psychedelics and have an experience. I think what it says is that anytime we use a psychedelic or we have a psychedelic experience, it does have the potential to be transformative. It also speaks to the fact that we don't really know what's going on with these experiences. This
mm,
whole idea of set and setting and trying to curate and optimize the experience for somebody with all this preparation and all this integration that's baked into it. And you have the perfect setting, like in a teepee somewhere with the right music and the right smells, and or in a clinical based setting with the right furniture and the right stuff on the walls. And trying to optimize it all. It's like, I believe in that. I think it's super important, but not to the exclusion of throwing shade on somebody who does it in a very
Mm,
different way, a very unplanned kind of way, no intention of changing their depression, their relationships to other people, no intention of giving up cigarettes or weed or alcohol or anything. But lo and behold, it
yeah.
happened. It happens. And for a lot of people, it can be delayed. There's research that came out of Matt Johnson's work where they looked at smoking cessation and the use of psilocybin. And I think I might misquote this a little bit, but one thing that I remember Dr. Johnson talking about at the MAPS conference in Denver last year when he talked about this is that those people who were in the psilocybin group, they showed higher abstinence rates for the first week or so. And
Hmm.
then somewhere along the way, both groups kind of leveled out. But if they looked at the long term, those people reliably who had the psilocybin experience about a year out had much higher abstinence rates from nicotine than those people who didn't. So sometimes there's like a delayed reaction. So somebody might have an experience that's transformative, like they tripped balls with their friends camping and they were like, what am I smoking for? I hate smoking. I feel like this is disgusting. I'm killing myself. And then for like a week afterwards, yeah, okay, I'm gonna go back to smoking again. But that experience lodged itself in their brain somehow. And a year later, they're like, I think I'm ready to quit. And they are only ready to quit in part because of that experience that they had where they're like, what am I doing? I'm killing myself. They're tripping and they're like smoking cigarettes, like, oh, this is
Yeah.
gross. So I think it's also that we have to keep in mind that sometimes there's a delay in the change, but that doesn't mean that the experience itself, when it happened, wasn't extremely powerful because it shows up later on.
Wow, that is extremely eye-opening for me to hear. Because actually I'm sober, what, like near 1,000 days, and hearing you talk about the delay is something that's really interesting because so a year before I decided to get sober, in my personal experience, when I had tripped, especially the last couple times, every single time, and it wasn't the intention, but would I would say, like, you got to stop with what you're doing. Like, you got to stop. This is horrible. You're like destroying yourself, your future. Just it automatically came to my mind every time. But I actually didn't get sober till a year later, and now and I had always said that, at least in my mind, that it was in part due to the psilocybin experience, but I thought maybe, like, oh, it's just a coincidence. But to hear you talk about the delayed reaction is very interesting. Like, once you have that experience, it's like it's still there, in the back of your mind, maybe. So that was really interesting to listen, to hear you talk about the delayed reaction. I've never heard that before.
Yeah, it's like the phenomena, like a bell has been rung that can't be unrung. You had that experience deep in your subconscious mind, deep in your psychedelic journey. You had some connection, some light bulb went off, and that laid down some sort of template or some new
Mm,
understanding, and that might fade. But then as time goes on, you're like, I think I'm ready to change. I mean, that happened for me
hmm,
with my experience with LSD, and I'll just share briefly. Like when I first used LSD, I was like, oh my God, I am changed forever. This is weird. I don't know what this was. And then I
mm,
had an experience down the road where I took LSD and I was like, oh my God, I'm connected to everything. Everything is connected to me and we're all connected. And oh my God, this is amazing. And then I had an experience towards the end of my addiction where I'm like, oh my God, I was like tripping and drunk and I was like, I'm going to die. Like I'm killing myself. Like I'm actually
mm,
going to die from drinking and using myself to death. And I was tripping really hard on LSD and I was like, oh, this is really so real. But I didn't stop drinking after that, but I did remember that experience when it came time to get sober. I was like, that experience loomed large in my psyche. I was like, yes, it is time to get sober. Like I can't, like I am
wow.
actually gonna die because I had that experience tripping. I was like, I am actually gonna die. And I decided, I
Mm,
guess I don't want to die. So
yeah. I could actually relate to, so you shared that you tried psychedelics at a young age. Me as well. I was 16 when I had a high dose psilocybin experience, and it's interesting to look at, through the years, when I had first tried it, the first couple of times. it was like incredible. Just, you can't really describe it, but feeling connected to everything around you. And just, again, it's hard to describe, but as I got older and older, and, I wasn't a kid anymore, I had, more problems to deal with. Obviously, as you get older, the experiences just got darker and darker and darker for me. And you talking about the last maybe experience before you got sober really resonates with me. It like scared me. It scared me to death, even though there was a delayed reaction, like you talked about as well. So very interesting. Dr. Barnett, to wrap this up here, what excites you the most about psychedelic therapy inside or outside of the medical model, for addiction in the future, and what worries you the most?
Well, I remain optimistic and excited about the research that's coming out. More and more of it's coming out every day. I'm sure you follow Psychedelic Alpha as
Oh
well
yeah.
as Blossom Analysis. Those folks at Blossom, they
Mm.
put together a great compendium every month of the latest research, and more research coming out all the time. I remain very optimistic about psychedelics. So I'm very excited about the directions of things, notwithstanding potential roadblocks along the way, and bad actors and problematic
Mm.
situations that arise. That's what excites me the most. What troubles me the most, I think, is the failure of the different camps that we might find ourselves in. Whether you're a psychedelic enthusiast or you're a skeptic, whether you're a researcher or a clinician, whether you work in the underground or you're a pharma person, like we all tend to dig our heels into the ground and tend to polarize ourselves from other groups. And it seems so troublesome to me that that's what we end up doing, especially in the psychedelic space. And, I think that there is a way to appreciate all the different perspectives and the camps that people find themselves in, and just say, hey, that has value in these ways, and I respect that. That has value in these ways, and I respect that. Rather than saying anybody who does underground work is unsafe, they're not regulated, they need to be
Mm.
regulated, they need to be criminalized, they need to be punished, they need to be, they're all bad actors out there, or all clinicians are bad clinicians because they have done, bad things to their patients, and we need to keep it out of the medical field because the medical field is just going to screw it up. And everybody has an opinion based on their own camp, and I think that's really dangerous, and it doesn't belong. I mean,
Hmm.
it belongs to the extent that we can have our differences of opinion, provided that it helps us grow and understand one another. It doesn't help when we start starting fights with each other. And it's really, we've seen some ugly stuff
Oh yeah.
recently.
Yeah.
And so that troubles me. The only other thing that troubles me somewhat is these are powerful medicines and people can be taken advantage of.
Yep.
And I think people who highlight the harms that can happen as a result of people seeking or having psychedelic experiences, we need to be having those conversations openly and honestly, but we don't need to have it happen in such a way that we are perpetuating a kind of fear mongering.
Hmm.
We need to shut this down because there's so many people who are being raped and
Hmm.
abused and all taken advantage of because all of these bad actors in the psychedelic space, they're all a bunch of cult members and stuff. It's like that's not the point of harm reduction. The point of harm reduction is to have an
Hmm.
open, honest, exposing conversation about the harms that can happen, but not to shut it down. And I don't think people who are sort of putting forth these harms have done a really good job of being nuanced about it, and that troubles me a
Hmm.
lot.
Yeah, really, really well said. And yeah, striking that balance there with pointing out the risks, but also not demonizing. Very interesting to think about. And, you know, I guess last thing I'll mention here, I was when you were talking about people thinking black and white, like, this is the model we need to do for everyone. You know, when it comes to mental health disorders, specifically people severe depression, I was actually, I was guilty of being someone who said, you know what, like, we need the medical model only for that. And then I really thought about it, and like, who's to say that it's not the best experience for someone to be at a retreat in Oregon out in nature doing one of these experiences compared to being in maybe a hospital bed with two therapists by you? Like, who's to say that that isn't even more healing for some people than, you know, the standardized therapy? So it's something I've been thinking a lot about as well. And I'm glad you brought it up. Listen, Dr. Barnett, thank you so much for coming on. I really enjoyed this conversation.
Me too. Thanks for having me. Hopefully, some people find value in it. And thank you so much again for having me on the show.
Absolutely. Thank you very much.
If you enjoyed this video, please like and subscribe, and we'll catch you at the next one.